that time. So as she said, my name is Angela Tay, and the other things about psychology and so forth and so on. But my role here today is as a parent. When I see and work with parents who have children that have mental illness, whether diagnosed or undiagnosed, it touches my heart because I know how it feels to be in that place. Right now my daughter is an adult. She's 36 years old. So when she was born, she looked and appeared just like any other baby. She looked healthy, had all of her toes, all of her fingers, everything was there. But as she began to go through the stages of development, I saw that she was lagging in different areas. Her speech was slower, and as she was learning to talk. And then by the time she was 4 years old, and it was time to get her ready to start going to school and that thing, I noticed that other kids were able to sit still for a period of time, but she would always be in things. She would always be, well, we would say, just destroying things. She would be into something all the time. But that's normal for a 2-year-old. But as you see your child getting older, you expect that they're able to stop if you say stop, or to come here if you say come here. But I saw that there was a break somehow in communication. The problem, though, was in the culture that I grew up in, although most of us here are people of color, we've grown up in different places, different homes, different cultures. But even in the culture in Georgia at that time, having a child that had mental illness was kind of like the boy who was born blind. And the disciples asked Jesus, who sinned that this child should be born blind? So if your child was exhibiting any type of what they would call retardation, what they would call being crazy, because it wasn't, people didn't call it mental illness then, if we really want to be real. We were really hurtful and mean to people that had what we label now as mental illness. So it was not something that anybody would want to be a part of. You wouldn't want your child to be labeled as crazy, to be retarded, something to be wrong with them. So you wouldn't go for help. And then what would we do? We basically would take it out on the children. We try to beat them into submission so that they can stop, so that they can sit down, so they can leave things alone, so that they can just act normal and not be misbehaving. Because that's the second thing. First, if you're not crazy, then you're just hard-headed. And a lot of times now, people are seeing their children exhibit signs of mental illness, exhibit signs of developmental delay. But instead of accepting that, okay, this is a problem that I need to seek help for, we try to train them into being what they are finding hard to be, and then it's exhausting as a parent. So today I just want to encourage any of you, if you have children or if you grandchildren, if you know of other people, and you start seeing signs of developmental delay. You see that this child just, it seems like no matter what I do, they won't listen. Sometimes the child, I'm talking to the child won't even look at me, they won't even pay attention. But the child has autism, but he hasn't been diagnosed. The child has hyperactivity syndrome, and the child can't be still. The child is not jumping around to torture you. Because since we see it as being a problem, instead of something that is a need, a sickness or an illness, if your child was sick with cancer, you would take him to the hospital. You wouldn't feel ashamed about it. You would take them to get the treatment. So if your child is exhibiting any signs of mental illness, seek help. There's help not only to help the child, but there's also help to assist you. As a parent of a child with mental illness, you hear people say, well, it's your child. All of our children are our children, but we have expectations. When you are expecting a child, nobody says that you're rubbing your belly and you're thinking, yes, I want this child to not be able to do this. Yes, I want this child to not be able to speak. I hope this child won't listen to anybody. I hope this child will be unfair. Nobody does that. You're praying. You're speaking life over your child. You're saying the things that you hope will manifest in their lives. So then when the child is born, and even if you don't see those things, our love can't change towards the child that God has given us. And so if we listen to the stigmas, those stigmas will turn you against your own child. Because you'll start looking at the child, is this some, thinking all kind of things. Is this some kind of black magic? Is this something somebody was doing to me? Is this something, some of you are looking at me, but you know it's true. Right. Is this something that has happened in the family? Oh, maybe. For me, I had an older brother who loved me dearly, always protected me, never done me any harm in my life. But because people looked at my child, they assumed that maybe her brother fathered the child. Because if there's incest, then they expect something to be wrong. We always in our culture see mental illness as a punishment. Something has to be wrong. This has to be a payback for something. This has to be something that's being done to you because it's something that you have done. So what happens? Then parents, they don't get help for their children. Parents will hold their children at arm's length because they're not helping them to see what their problem is and to work on what is causing it. But instead, they're trying to, by other means, to try to force them to be what they're not able to be. Yes, you want your child to be a doctor. Yes, you want your child to be a lawyer. And you're saying, this child here, and the things that we can speak to our children. You stupid, you this, you that. What do you think that will help? No. So we're here today on the panel to be, I want to be real. Because I hate to go to a mental health fair, having a child that has mental health, and then you leave people that are there that are saying they're mental health champions. But they see that same child do something, they're laughing at it. They're picking on them as if they don't have any feelings, as if they don't understand that they're being made fun of. But you say that you are, yes, we all need mental health. We all have mental health issues at different levels. When you see it at an extreme level, how do we support other people that are in our community? How do we support other people that are in our family? When we see that maybe a child is misbehaving, maybe a child is acting some kind of way strange, do you tell your own kids, no, you don't need to play with this one, as if it can rub off? So as a parent, I just want to encourage us to be thoughtful. Be thoughtful about the things that we do and say while we're seeking professional help for our children. There's so much help out there. There are waivers, there are grants, there are so many things that can help you to be able to access things that you may not be able to get on your own. As for myself, my daughter was 16 years old before I accessed any kind of benefits that could help her, that could give her things that were adaptable, that would help her to learn better. She was 16. Why? Because I didn't want her to be crazy. I didn't like that people would be pointing at her or calling her names. I didn't like the things that people would think about me or about my family. So I didn't want it to be so. And I heard somebody say earlier, they talked about prayer. Let me tell you something. Without prayer, I wouldn't have made it. Yes, seek help, but you even need to seek the one who made us to find the right help. Because help that's helpful for one person may not be helpful for another person. So you seek God to find out what avenue you need to take. Does this require medicine? Does this child need medication? Does this child need therapy? How should I respond to this child? So all of those things are things that we have to be thoughtful about. Then we need to be thoughtful about our own mental health. Because when you are a parent and you are parenting a child that has mental health issues, yes, it is a job. It is a job. There are expectations. Those of you that have children that have no mental health issues, you know that that's a job. Now imagine parenting a child that is hard to reason with, or a child that's nonverbal and they're not able to express what's going on, and they're not able to respond to you, and you don't know how to respond to them. So I'm so glad that we have these settings, but I just hope that we sincerely take them to heart, that we listen to the providers that have come before, that have given us kind of guidelines on things that we should do, that we actually listen to those things and do it. Because all of the years that I prayed and fasted for my daughter to be healed, God does heal. He heals cancer, but it's not every cancer patient that prays. There are things that God allows to happen in our life that's for His glory. But when the things that are for God's glory, it doesn't always mean that they will feel good or they will be the outcome that we expected. but yet God can be glorified. So continue to pray, continue to seek God, and then seek help.
Amen.
Great transition. Thank you, Dr. Angela. That was awesome. Next, we will move to, are you saying that right? So we'll move to Dr. Howard. So Dr. Howard, is this a good transition? As Angela just stated, the importance of faith. So Dr. Howard is an ordained minister and a missionary with Harvard International Ministries United. He oversees theological education, spiritual formation, and minister credentialing and leads the Harvard International Church in Maple Grove, Minnesota. He's also the lead chaplain at Gillette's Children's Specialty Healthcare and a staff chaplain at Regent's Hospital. He is an accomplished marriage counselor, a teacher, an author, and an international speaker. Dr. Howard has also written several books, and he is a proud husband and a father of four. Please welcome Dr. Howard.
I think it's good for now. Well, thank you. I'm glad to be here. As I was told to introduce myself, I think she's done a good job. The other thing I like to emphasize is that in my role as a chaplain at Regent's Hospital, I am responsible for the mental health unit, and Zadia is a part of that. She works there. Mental health, Northeast 3, 4, 5, 6, 7, and 8. And so on average, at least I see at least 5 patients Monday to Friday on the mental health unit. So I engage with mental health patients very regularly in my line of work. And so I was asked to talk about if I have encountered mental health and how it has affected me and all of that. I want to echo what one of the previous speakers said, that we all, at one point or another, have had, or we are dealing with mental health. All of us, right? There is not a single person, you can be a pope, even the pope himself that we just got, is probably dealing with mental health right now, okay? In light of all that he has on his plate. It depends on how it's manifested and at what level before we go to seek help. So we all, so never try to downplay whatever situation anyone finds himself in or herself in. But when it comes to faith, when it comes to mental health and our perception that all we need to do is pray, like Reverend Angela said, we all need to realize that God, I always say, God always gives us enough victories to keep praising Him, but yet He always gives us enough challenges to keep going to Him. Okay, keep going to Him. So all of us, if we were to do a survey here, all of us in this room, we're going through some kind of issue. All of us. There is no exception. And at the same time, all of us have, and let me be a little more personal, all of us here that have kids, there's not one person here who can say, my kids are perfect, and I will not hope that something will change, right? All of us in here, we all have issues. Our kids have issues. Parents have issues. We all have issues. So our faith does not negate the fact that we are, quote unquote, people of God, children of God. It does not negate the fact that we will not have challenges. It may help us to be able to navigate the challenges that we have, but the challenges are not erased. So we need to realize that we will.
No, we've actually, because a couple ladies said that, and then we would have.
Hey, these are the volunteers. These are the guys that put all of this together. Hey, LIB in the house. Y'all did an amazing job. An amazing job. Make your way. We're still here. Make your way. Hello. Mhm. Yes. We are here till 2:30.
Oh, okay.
These beautiful women are here.
Okay.
This is versus him.
Hi, I'm Benita.
Hi, Miss
And-
Benita. Thanks for all you do. It's an honor to have you guys here today.
Thank you.
Yep. Hi. Thanks, everybody. We are live. Can I come in? These are all the doctors and professionals, and we just want to say thank you so much. We appreciate all of y'all for being here and to be a support. Thank you guys so much for your hard work. You guys want to tell us where you guys from, what hospital, what healthcare?
Homeland Health Specialists,
Homeland.
Homeland.
Have you been on there?
Yeah, I just built the area,
Okay.
sitting area, but
Okay.
outside, yeah.
It's very nice.
So I just thought of that.
So,
Yeah. Right. Right.
And then third, God assigned you for someone to take care of him. There was an assignment. He got to the point where he was so depressed, he went to God and he told God, take my life because I'm the real prophet that is alive. And God had to say, no, that's not true. There are other prophets that are still there. He was a man who had experienced so much victory. And yet all of a sudden, things switch. Okay? So hear me, I can go into a lot of things about what happened with other characters in the Bible. But mental health is, and let me dare say this. At one point, Jesus himself encountered mental health challenges when he was on the cross. Right? Because God, he knew his purpose, but yet on the cross, what did he say? My God, why hast thou forsaken me? Okay, tell me that's not mental health crisis. Tell me Jesus himself was at a place where he doubted himself, he doubted the Father. So we all go through that. What we do, please hear me. Seek help when needed. And I think sometimes though, when we experience fear, fatigue, failure, okay, and sometimes you feel your life is futile, sometimes you go through these challenges, but we have to step back and seek help. And as a pastor, as a Christian, as one who works with mental health patients, and one who has to constantly guide myself from going deep into depression. Listen, Christians have a way of frustrating you. There's a pastor who visited me right now. He said, if God wants to curse a pastor, he assigns you to black people. I didn't say that. That's what he said. That's what his pastor said. Okay. He said, God assigns you to black people. Then you know that you're a pastor or not. Okay. But please, I think if we're not making this, seek help, pray, talk to others, and give. Amen. Thank you, Dr. Howard. Our next, can you hear me? Our next speaker. Our next speaker is Dr. Robert Wood. He is with mental illness in primary care setting. Dr. Odom is a primary physician, a founder of Odom Medical Group, a community-based primary care practice in Minneapolis, Minnesota. His professional interest includes communicable diseases, vaccine, preventable illness, and governance. At least we know who to call him. He is committed to providing comprehensive care to diverse populations. Thank you, Dr.
Thanks for having me, and I've been very impressed with all the sessions that we've had. provide you with the resources that you need if you need to access help. For us who are in primary care, I think most of the time we tend to be the main place that most of our community members who are looking for treatment go to. I think we have been set up in such a way that everybody thinks that we don't have time. And so that becomes a big problem for us when we're trying to work with patients. And because when it comes to issues surrounding mental health, we need time to be able to talk to the patient. And so, after the first visit, you're trying to call the individual to come back for a follow-up, and that's always a challenge, in as much as we're interested in helping our patients. So I think the first thing I would elaborate on is access. Traditionally, access to primary care services are not that many in where we live and work. Because as you know, transportation, being able to go to doctor's office is one of the primary processes for people seeking care. And we're hoping that in the years to come, we will be able to address that. There were some initiatives in the last few years to see whether the use of mobile health can be a way to provide care to patients. We have been championing that vision, talking to state leaders and policymakers, and even explaining to some health systems why is it a tool that we use. Most of us are trained in residency where we go to sit in the doctor's office and then wait for the patient to come. And if the patient doesn't show up, I think that's misguided. But in this to go to somebody's home, it's considered an extension of the doctor's office. And for those of you who are professionals in practice, I would like to bring that to your attention. And those are areas that you can look to and collaborate with your insurance providers. And they would certify that you can be able to go to patients' homes and see them. I didn't go today, but every weekend on Saturdays, I run a clinic in St. Cloud, and we see anywhere from 10 to 20 patients on the mobile clinic. So access, I would say let's open up our schedules. For those of you who work in health systems, you can talk to your schedulers, because sometimes when people call for appointments, there's always a challenge that the scheduler is sort of, because we try to make appointments to see, to send people to your offices, and we wish we could talk to you personally, but access is our biggest challenge. Even when you've identified somebody that we believe needs your expertise, access is a problem. Now, one of the things, our job in primary care is to identify, treat, and then refer. The first one I'll talk about is children. For those of you who are familiar with the child and teen checkup process, it is a primary tool, and again I'll say the primary tool for identifying any mental health issue in children. And I don't know why, but in our community, we don't pay much attention to those visits. The 2-year-old, the 2-month-old, the 4-month-old, 6 months, 9 months, 1 year, 15 months, 18 months, 2 years, 3 years, 4 years. The reason being that if there is an identified mental health illness, when we file a claim to your insurance company, there are codes that we put on that tells the insurance company that this particular child has needs that will have to be addressed. And so the various services that you would need would be much more enhanced and easy to access if these issues are identified during the well child check visits. We also need to understand that for your child to be able to access services in the school and through social services, it's always advantageous to the parent, to the family, to the community for the diagnosis to be made early, like you just talked about. And the earlier we do the diagnosis, we can provide most of the interventions. The reason is that those interventions cost money, and there are specialized places that you have to go to, and without having a diagnosis that is certified by your insurance company, you cannot access the caseworkers at the county offices, you cannot get those social services which you need, and it's available. It's something that it's there. It's not a stigma to access those things. Many of our community members from different parts of the city access those services. I work in a clinic out in Rogers, and I had this colleague who had this huge file about this, and it's basically patients that have been diagnosed with ADHD that he sees regularly. They have an approved contract with parents, and parents will even come and call me and say, I give you a 3-month supply of the various treatment that I'm getting. And so, what I'm saying is that please access those services. And don't be worried about, like you said, being diagnosed with a particular condition, because if we diagnose you early, you will get the treatment that you need. So please, those of you who have sisters, mothers at your church place, tell them to go for those well child checks, because the tools in there are evidence-based tools. It will pick up any mental health issue that your child has early, and we will set up the referrals for you. It also allows them to get the help right away when they have to enter the school system, and not struggle through the lengthy IEP programs that you have to, you get a call from the teacher, and this is going on, and that's going on. And if we can get those well child checks done, we will be able to help a lot. The next one I'll talk about is ADHD in adults. That's something that has been lots of people are struggling with because they were not diagnosed with ADHD when they were children. And so once, sometimes they struggle to college, but when they get to the workforce, there are other problems. Primary care is there to help. I think the guidelines now are to send them over to a psychologist and to get the diagnosis, and we can provide them with treatment for them. We already had a speaker who spoke about treatment. Depression, anxiety, we will diagnose, we will treat, and if we have challenges, we will refer. Our job is to identify and educate on the treatment that is available. The moment you tell someone that you need to go to a psychologist, it's like you probably have to call them 5 or 6 times to get back to the clinic. That is part of the treatment, because talking to someone, a professional, is where you actually begin to get the treatment that you need. We also spend a significant amount of time explaining to patients how the medications that we have work. Because if we're able to explain to them in the primary care setting how the medications work, it's very easy for them to transition to see a mental health provider. And sometimes they go and they come back to us like, what is this medicine for? Why am I on this medicine? Oh, that, person said this medicine is for this group of people, and I don't want to take this medicine. So we're there. So let your communities know that we're there, and we would be readily available to support, making sure that mental health is addressed quickly, and the patients and the community will get the treatment. Thank you.
Thank you, Dr. Oda. So, just a quick reminder, we have the program sheet on each of the tables. There's a QR code that will allow you guys to do a survey as we head towards the end of the program. Everybody get a cell phone, that you just click on a simple, I think 7 or 8 questions. Can you please fill it out so that we can go? Yeah, if you're not comfortable with using your phone and the QR code, we can give you paper ones too. So thank you. And then just in the interest of time, we'll continue. Let's try to all keep on schedule. So next we'll go to Susanna Okotora. Susie, am I pronouncing your last name right? I'm sorry if I butcher it. Susan is a board certified midwife and the CEO of Lively Wellness, where she supports working class women in restoring their health and longevity through holistic care. As a midwife, she is passionate about addressing every aspect of a woman's life. She is also a proud mother of 4 children and a member of this organization. Please welcome Susie.
Thank you, Cynthia, for that. And thanks everyone for being here. Thanks for having me as well. So I'm here to talk about postpartum depression. We know that postpartum depression, as the name implies, is depression that's diagnosed after a woman gives birth. So postpartum depression is usually diagnosed after the 6 weeks, of giving birth or up to a year postpartum. There is a condition called postpartum blues that is kind of like the mild form of postpartum depression, but it's not depression. There are some people that would misdiagnose that as depression, but it shouldn't be confused for depression, for postpartum depression. So postpartum blues essentially is caused by mood swings or mood change that occurs after birth, shortly after birth, usually about 2 to 3 days after giving birth, and it could last for up to 2 weeks or so. Majority of women actually do go through postpartum blues. I would say maybe about 80% of women would have some postpartum blues. Some risk factors of postpartum depression includes being pregnant and having a baby. That's number 1 risk factor. If you also have an underlying mental health condition, that would definitely put you at risk for having postpartum depression. Sometimes trauma from birth would cause postpartum or negative experience at birth, which we know that some Black women would have some type of negative experience. That includes me within the health system. So that would also put you at risk of postpartum depression. So some risk factors, some risk factors. I'm sorry, I'm losing track. So some of the symptoms of postpartum depression includes mood changes. Some people would feel more anxious, some people would feel sad, just losing interest in doing things. Some would feel worthless, feel like they're not adequate to be a mom. And it varies, it ranges from, again, sometimes people would have anxiety, a mix of that, anxiety and then feel depressed. Lack of sleep as well. Others would overeat, some would undereat. And so, how do we prevent postpartum depression, right? Number 1 is to make sure you have your resources available So plan for who to talk to if you were to have postpartum depression, if you were to develop postpartum depression. So I advise my clients when they come to see me to have their 4th trimester plan, which is the postpartum plan. And that is they usually start at the last month of pregnancy. So from 36 weeks up to delivery time is when I help them come up with some kind of postpartum 4th trimester plan. And that plan would include your support team, a community of people that you can reach out to if you were to be experiencing postpartum depression. There are some practices that are ingrained in some cultures, like the Chinese culture, where they call it saving a month or Zhuo Ye Ji. I hope I'm pronouncing that correctly. There's also this practice called quarantina in the Hispanic culture. In the Igbo tribe of Nigeria, there's the Omugo. And those practices essentially, they come together, the community comes together during that first month where the mom is at risk for developing or having mood issues. They come together during that time to assist with resources such as helping the mom bathe, assisting with feeding baby, just helping the mom to get rest and recover through that postpartum, at least the first month to 6 weeks postpartum. So it's very vital to have that community resource. I cannot stress that enough. I know we are in a world where everyone is busy and we're all individually doing our own thing. But it's, again, it cannot be spoken of enough to have that community assistance or that resource available at least a month or so prior to delivery, so that, again, if there was some kind of crisis, you know who to call or prevent crisis from happening. So ways that we screen for postpartum depression, number one way is when you come in post-delivery, 6 weeks post-delivery, we give you a questionnaire to answer. So we give you a list of questions called the EPDS. And you do want to be honest with the questions that we ask. And the reason why I mentioned that is I had my own personal experience where with one of my children, I knew that I was at risk for postpartum depression because of my experience during the birth, prior to and during the birth. But I lied on the questionnaire because I was, of course, a Christian, and you cannot be depressed, you cannot be anxious, and I struggled through that, through postpartum depression for one of my children. But then when I learned and knew better with my last born, I was also at risk at that time. Again, being Black, experiencing healthcare. But I knew better, so I honestly answered the question, and I was in that way able to prevent postpartum depression the second time around. So it's very important to be honest with the questions they ask. I know that there's a lot of stigma with depression and healthcare and so on. And so we try to answer in a way that we're not incriminating ourselves and we're not labeling ourselves, but it's very important to answer those questions and seek the right help at the time. So in the pediatric offices are another resource where there's, they do provide screening for postpartum depression. So if you're not able to come to majority of our postpartum because if they're busy and so on, they may not be able to see us in the OB clinic. Pediatricians are also equipped to screen for postpartum depression. So when you take your baby in for the well check, they should be screening you at that time for postpartum depression. You, the mother, for postpartum depression. So that's another checkpoint. One thing I must mention, because I am also in the wellness field, vitamin D. Vitamin D is an essential part of preventing depression, especially postpartum depression. So that's another lecture I go over with my clients at least a month leading up to delivery and continuing it you should get vitamin D all throughout regardless. But more importantly, increase your vitamin D dosage, whether you're getting it through the sun exposure, early morning sun, or you're doing your supplementation. It's very important to have an optimal level of vitamin D during the late pregnancy period leading up to the postpartum period. I've had many clients come into my office because, trust in seeing a black face and so on. They're not pregnant, they just want to talk about depression. And then when you check their vitamin D levels, extremely deficient in vitamin D, we correct it, and their mood improves. And these are patients that have been diagnosed with psychosis too. So it's very important to supplement with vitamin D.